up, everybody? How are you? My name is Tamisha, also known as Mrs. Coda. So today I'm going to be talking about the forgotten ADL, which is addressing sex, right? So this is a big topic that is often overlooked when it comes to our patient care. We got to keep in mind that this is a big part of relationships is having sex, right? So something I want to address when it pertaining to this is your patients may be suffering from maybe incontinence. They may have had an amputation, a laminectomy, maybe a hip replacement, maybe they have cardiac issues. So all of these may be impacting their sex life, and they're coming to you for not just physical rehabilitation, but they want to know, how can I fix this particular area that is such a sensitive topic, but it's so effective in my life, my day-to-day life. So how do you address this? How do you have this conversation? How do you do this training, right? So the first thing is you need to find out the needs of the patient as well as their spouse. What are they in need of? Obviously, you know they're in need of sex, but people look at sex in different manners. Like, do you use certain things? Do you not use certain things? Like, this it's just having a conversation on exactly like, what do you want to see happen in your relationship moving forward? Like, what are your sexual goals? We can say that, right? Then the next thing is talking about positioning, right? How do you have to position now that you have an amputation? How do you have to position now after you had a laminectomy surgery, right? What devices can be used? Do we need to use a wedge? Do we need to, do other things? So this is a conversation on how can we compensate, right? And then the third thing is intimacy, right? What kind of strategies can we create intimacy for the patient and their spouse? Is there a sensation issue happening? So there's so many things that you can do when it comes to this. Now, if you guys are interested, go ahead and check out this interview that I did with an OTR that specialized with sex and intimacy when it comes to rehabilitation. So I hope that this was helpful. Be sure to like, share, and subscribe. Go ahead and check out her website. Here's a look at it, and here's a clip from that video.
I viewed this as a problem, and a problem that I wanted to fix, and an injustice that I wanted to fix and fill the gap. And so really I was most attracted to it because I felt like it was a problem that a lot of people, for so many reasons, shy away from. And then, of course, getting into it, I fell in love all over again, because it is a really interesting topic, complex and fun topic to talk about.
Yeah. So what setting did you start off with when you became an OT? Did you just kind of jump right into learning it, or where did you work for, initially?
Yeah. So my very first job was at an active duty military hospital. And This is the job I had for the last 9 years, and I just left in July. So I started out in the acute care setting, just typical acute care. And I was working with people that had severe combat injuries, and they would come back and be really, really sick. And a lot of times their spouses would ask about sex and intimacy. And oftentimes this was met with discomfort from the staff and a lot of judgment from the staff. And actually there was a story where one of my coworkers had come, she was an OT, and she came running into the office, and she was beet red, and she was like, "Can't believe what just happened to me." And she said, I was showering. She was working with a couple where the service member was showering for the first time in probably 3 months. Their spouse was in there with them, and the spouse had a white t-shirt on, and the spouse took off the white t-shirt and said, "We don't want to have a white t-shirt contest up in here." So they did the shower in their bra, and the OT that was there she was really uncomfortable with the whole thing. And she comes running into the office, and she was sharing her discomfort, and I related to that discomfort, but when she's telling the story, I was like, oh my gosh, that sounds awesome. I was like, that just sounds really great.
Yeah.
And that they were trying to keep the spark and the romance and the
Right.
flirtation, you know?
Right. And I hope that this was helpful. All right. Till next time, guys. Take care.